In 2023, when India had vaccinated over 90% of its population, most of us believed we had seen the last of COVID. However, 2 years later, the deadly coronavirus seems to be re-emerging. New strains have already affected nearly 7,000 people and caused 37 deaths. Welcome to Beyond Averages, our weekly data show where we look beyond the numbers. With cases rising by 50% over just the last 4 days, the question we are now asking is, does India need a fourth dose, and is this something we'll have to deal with annually like the flu? To help us understand the situation better, we are joined by Dr. K. Srinath Reddy, public health expert and founding president of Public Health Foundation of India. Dr. Reddy, thank you for joining us.
Pleasure to be with you.
I didn't think we would be talking about COVID after 2 years, Dr. Reddy, but here we are. But before I move on to you, let me just take our viewers through some of the numbers that we are seeing as to COVID. Just give me a moment. If you look at it, active infections have actually increased fourfold over the last week. On 26th May, we had about 1,010 cases. Today, we have 4,026. In terms of total cases, they've jumped from 1,321 to 6,763. Deaths have gone up from 6 to 37, about a 6 times increase there. Moreover, which states are getting infection? If you look at that data, you will find that 5 states account for 75% of the infections. Kerala with 1416 is the highest, followed by Maharashtra at 494 and Gujarat at 397, Delhi at 393. You have UP at 138 here. These are active cases that we are talking about. Dr. Reddy, let me get back to you on this thing. Is this resurgence a one-off event, or should we be prepared for more frequent waves going forward?
First, let me clarify what a case is. A COVID-infected person is not a case of COVID, because COVID, by the WHO definition, is one who has developed the illness. COVID actually refers to the illness caused by an infection by the SARS-CoV-2 virus. The fact that we have tested and found that somebody has been infected with SARS-CoV-2 virus does not automatically make that person a COVID case. So that's an important distinction, because we know that prior immunity, however acquired, is not likely to prevent an infection. It will most likely prevent a severe illness and certainly help to prevent death. But it is not going to prevent an infection by the new virus variant. So I think calling all of these cases is firstly a misnomer. Secondly, we know that COVID is here to stay, and it's going to be an important respiratory virus among many other respiratory viruses which continue to stay in our environment. Influenza viruses are an example. And COVID will continue to change form. Fortunately, we are still now having the Omicron and its variants, which amongst all the SARS-CoV-2 virus lineages has turned out to be the least virulent, though it's quite infectious. So seeing this sporadically come up again in the form of new variants and infect more people with the virus, but not necessarily causing severe disease, that's going to be a recurrent phenomenon unless the virus changes into a more dangerous form. And that dangerous form is not likely to occur unless it actually acquires part of the viral genome from another virus. What happens is we have antigenic drift and antigenic shift. Antigenic drift is when the same viral genome continues to modify itself with slightly new forms, but essentially retains the same characteristics and the same type of clinical features. But an antigenic shift occurs when it sort of merges with the viral genome of another virus and then starts producing a totally new form of virus with a different genetic pattern, and that can be dangerous. Right now, we have no evidence that the SARS-CoV-2 virus, the Omicron variants, are actually going into the antigenic shift mode. At the moment, they are just changing their form in the antigenic drift mode, and new variants are going to come up. And fortunately, they're still following the original Omicron pattern of being highly infectious but not highly virulent.
So there have still some deaths that have happened. Those are mostly in cases with severe diseases, people who have comorbidities. So do you think the state level response so far has been good enough, or should we need to consider reinstating measures like contact tracing or fecal surveillance, wastewater or fecal surveillance?
Well, basically, as far as people who are more likely to acquire a severe infection and die are people with severe comorbidities or a very severe dose of exposure to the virus, which their innate immunity or acquired immunity is unable to overcome. So most people will not require that. Certainly, masking will help if you're going to be in crowded places. And certainly, if you're a mother who is treating a child with leukemia, who is not very immunocompetent, immunodepressed, or immunosuppressed because of the medicines, then certainly you have to wear a mask and make sure there's adequate ventilation. But whether all people require boosters is a moot question at the moment because there is really no reason to ask for boosters at the population level. But precautions like what are COVID appropriate behaviors are to be recommended, particularly to avoid crowds. And certainly, if you're moving in crowds, to mask yourself, keep washing your hands. All the COVID appropriate behavior recommendations of the past are still relevant. And they not only help against COVID, they help against influenza and other respiratory viruses as well. So going in for boosters at this point in time is not really called for, but all the other precautions certainly would be helpful for those who are at risk.
So talking about boosters, you just said a fourth dose or a booster is not important. My question to that is a precautionary dose important or not? Because if you remember, about 20% of the population had got the precautionary dose in the country. Just let me take the viewers to some data there as to who got a precautionary dose, and then I'll come back to you on the same question. So if you look at people who were first dose vaccinated, the adult population, for India it was 24.8%. In some states like Telangana, Andhra, it was about 46%. We have Maharashtra at 11.5, Punjab at 8.5. So, sir, coming back to that question again about precautionary doses, how important are those actually? Most people had got it at that point of time, about 20% of the population, but a lot of them didn't.
Well, immunity is acquired by very many ways. Firstly, you have your own innate immunity, but acquired immunity comes from vaccines and from natural infection. It's very likely that even those people who did not get the booster dose have hybrid immunity, partly acquired from the vaccines that they received, whether it's one dose or two doses. And secondly, also through exposure to the virus, symptomatic or asymptomatic. Also, we must recognize that even if the antibody levels have come down, there are T cells, particularly helper T cells, which still exist, and they can have a recall memory and can help again produce some of the antibodies as well. So we are not totally defenseless, even if we did not get a booster dose, particularly against a virus which is not very virulent. At least at the moment, it does not appear to be very virulent. It's following the same pattern as the other Omicron variants. So at the moment, I do not feel we need to have serious apprehensions about people who did not receive the third dose, though ideally they should have had when they had the opportunity. But a lot of time has passed, and during this period, some of the immunity might have waned, but some of the T cell immunity would still be there for recall. And also, it's possible that hybrid immunity has really extended its protective shield across the population.
So, what about the second dose? A lot of people didn't get the second dose either, and this was more amongst the youth population. Taking you back to that figure again, if you look at it, amongst the youth, the second 12 to 14-year-old, the second dose coverage was 78.8%, 15 to 18 was 86.6, and 18 plus was 94. So, how important is the second dose? And those who didn't get a second dose, do they also need to go and get the vaccine now?
Well, ideally, they should have had it then. If there's an opportunity to get it now, they should take it. But the simple message is that by now, most people would have acquired some level of hybrid immunity, and young people without comorbidities are not likely to be severely affected even if they are infected. So I don't think there needs to be a panic among them as well. But good public health advice is when the government issues advisories based on clear-cut evidence that certain vaccines are helpful under certain conditions, the population should take it.
Dr. Reddy, at that point of time, there was this discussion about nasal vaccines as well, that they would be better in providing immunity and protecting us against future waves of COVID. What has been the progress on nasal vaccines, and how different are they from the ones that we've got?
See, what we have actually produced systemic immunity because we have different types of vaccines. We have virus vector vaccines in which the antigen is carried by a carrier virus and introduced into our body for our immune system to react. Then we have inactivated virus vaccines that we have seen, for example, Covaxin, which actually is helpful in presenting not only the spike protein, but a wider array of the virus antigens to the body. Therefore, unlike the spike protein specific antigens, which produce a huge boost of immunity against the spike protein itself, but not very effective when the spike protein keeps changing its form, this particular inactivated virus vaccine has immunity against a broader array of virus antigens, and that may be helpful when variants emerge. And then you have, of course, had other vaccines, including the DNA vaccine and so on. And most important, the viral subprotein unit vaccines, which actually we have a lot of experience in producing in this country. And that also is helpful, but that is also helpful against the spike protein and still retains a moment of efficacy against the variants which have brought in changes in their spike protein configuration. But the nasal vaccine is something that produces mucosal immunity. It produces immunity in the nasal mucosa. So the virus finds it difficult even to enter and establish itself in the upper respiratory tract. The other vaccines cannot prevent that, but they prevent it from producing a severe disease by attacking the lungs. So they protect you against severe illness and death, but they don't protect you against infection. Whereas nasal vaccines have the potential to do that by producing mucosal immunity. But so far, the development has been rather slow. And right now, globally, the trials have not really taken place in order to establish how effective they are. In fact, the natural infection with a circulating non-virulent virus variant is probably going to be serving very well as both a nasal vaccine and a systemic vaccine, for that matter.
So, is there a seasonality to this as well, Professor? Because May, June used to be the time when the Delta wave came, and then later on Omicron wave also. So, we are looking at a surge of infections. Is there a seasonality to this as well?
Well, people are looking for seasonality. Globally, the seasonality can never be established as a single season because seasons have different calendar periods across the world. So unless we watch this pattern for a little longer time, we'll not be really able to comment about seasonality. But recognize one thing, seasonality is an important factor when there is very little of travel. Now you have so much of travel within the country from one geographic and environmental zone to another. You have so much of travel internationally between one country and another country. Therefore, viruses which emerge in one place can easily be carried to other places. It's not like The viruses are sitting and just watching the calendar. They're traveling with people.
So, one more question to this, because we were talking about booster doses and how we have developed this hybrid immunity. What about those with serious comorbidities? Would they need booster doses, or is that not required as of now as well?
Well, ideally, if they've not had booster doses, they should get it if they're available, whatever the government policy is, whenever it emerges. But they should take other precautions. I mean, instead of just waiting for booster doses, wearing masks, avoiding crowds, ensuring that they take plenty of water and fruit and vegetables to build up their immunity. All of these are going to be important elements. Avoiding smoking. All these are going to be important. Having good physical activity, which also is an immunity booster. So they should not sit quiet waiting for a booster policy to be announced. They should protect themselves. Mask is a very good protection. If worn properly, it prevents the entry of the virus into the nose. And if you can actually ensure that, you're avoiding a fair amount of danger to yourselves. The mouth and the eyes are also vulnerable. So frequently drinking water, washing your mouth, washing your eyes, these may be helpful. But most important is don't venture into crowds unprotected.
That would protect you against the flu as well, that's also going around.
Yes,
So,
it protects against a number of respiratory viruses. Therefore,
so
that's a good habit to develop.
Professor, a few more questions as well. Many patients had reported lingering symptoms or post-COVID complications, what we know now as long COVID. There were studies going on. I remember reading one last year about long COVID in Britain. So, what do we know about long COVID studies now? Where are they going, and what's been the situation there?
Well, a number of studies have been carried out internationally as well as within India as well. We know that long COVID does affect people and affects even younger people. It is only partly related to the severity of the original infection, but the virus does seem to have an impact. It's partly immunologically mediated, it appears, but I think we still do not have clear-cut answers on how protective the vaccines are against long COVID, though there is some preliminary evidence that suggests that people who have been well vaccinated are unlikely to suffer severe long COVID. But the treatments for it are still being tried out. But I think the best way of avoiding long COVID is to avoid the first infection itself.
And when you say well vaccinated, what do you mean by that? A
Well
booster dose
vaccinated,
or second?
well, ideally, if they've had a booster dose, yes. But let's not ignore the fact that even 2 doses are better than no doses. Even 1 dose is better than no dose.
Of course, of course. One more question, sir, because a discussion about COVID cannot be complete without the discussion about public health infrastructure. Do you believe we need another government-led public awareness campaign as far as masking and others are concerned, other preventive measures are concerned? And finally, did we frit away our lessons that we learned from COVID about public health spending and public health infrastructure?
Well, I think the government has been giving messages that people should avoid crowds and preferably mask if they do. They've also been emphasizing again the COVID appropriate behaviors without alarming people that there is imminent danger to everybody. So I think that's a good messaging that's going on at the moment. But I think a lot more needs to be done to reassure people, because there's a lot of fear among the people because of some of the media coverage about cases going up fairly high in numbers day by day. But that's bound to happen in terms of infections. What we need to watch is the number of severe illness cases and the number of deaths. If you look at the whole COVID phenomenon like a pyramid, at the broad base of the pyramid, you have people who are infected but are asymptomatic. Then you have another layer who are infected but have mild symptoms. Then you have a layer with severe illness, and then you have the deaths at the top, which is the narrow end. As long as most of the happenings are in the bottom layers and the top layer of severe illness and death are very minimal or very low in numbers, we should not panic the people. I mean, public panic is not warranted at this stage. but certainly cautionary behavior is warranted, even to avoid the infections and mild illness. So I think the government messaging is going in that direction, but certainly the media should play a role also in providing that messaging, because if the media starts saying, oh, cases are going up, oh, terrible things are going to happen, then people are going to panic. I think what we need to do is to reassure people, at the same time tell them to be much more sensible in their behaviors.
And that's why we have experts like you as well coming on our show, just to clear some doubts of that people have regarding this re-emergence of COVID. One last question, and this is regarding public health spending. You've written a lot about it, and you write consistently regarding budgets as well. We have seen government health spending return to pre-COVID levels in most scenarios. Most of us thought that that would sustain and it would help in public health infrastructure. What is your commentary on that aspect? Do you think we need a more, of course we need one, but do you think the government needs to up its spending again in this regard?
Yes, I think we do need to spend a lot more on our public health infrastructure. I think some of that is happening under the Ayushman Bharat Health Infrastructure Mission, which is also establishing a number of surveillance systems from the village upwards to national laboratories. The whole chain of surveillance is being introduced. Wastewater surveillance is also being improved upon. However, our weaknesses lie in our human resources. We are short of adequate human resources in primary care, in secondary care, and elsewhere, and that's particularly manifest in some states more than others. And we need a much better, well-coordinated referral systems and better integration between primary, secondary, and tertiary care as well. I think some of the states like Kerala and Tamil Nadu are doing very well. Some other states are not doing very well. So the central budget certainly must go up, but states also need to spend a lot more on public health, particularly in developing a much larger, fairly competent health workforce. And that may not be possible immediately in the short run. So training a large number of technology-enabled primary healthcare workers who are well community connected and draw upon the community's own resources for surveillance and monitoring and any outbreak response would also be helpful in the immediate future.
Thank you, sir. Thanks a lot for your time. As Dr. Reddy said, we don't need to panic, but we need to be cautious. Masking and other preventive measures are more important at the moment. Those who haven't got the second dose, it would be preferable had they got their doses, but hybrid immunity still exists, which will prevent until and unless there's an antigenic shift in the virus. Thank you for watching Money Control. We'll be back next week with more news and analysis. Thank you.